We even saw some blue sky in Beijing, I believe, yesterday, 5 minutes away from 9 o'clock. Good to have you with us this Monday morning. Now, most people find the idea of clinical trials concerning, and yet they are an important part of medical science and one of the best methods of determining which treatments are effective. We're here to weigh out the risks and benefits of clinical trials and explain exactly what's involved is Dr. Shaun, founder of P3 Research, who's conducted more than 50 trials himself, and that's here in New Zealand.
That's right.
I don't tend to think of it as so much as something that happens here.
Yeah, there's quite a bit going on, but I think we should be doing a lot more trials here.
What kind of things, what kind of drugs are we testing here?
Well, you know, a lot of cancer trials are ongoing. If you've got cancer and you've been treated in hospital, there's a good chance you'll be offered a trial. We do a lot of asthma trials and diabetes trials.
I would think with things like that, people will be looking forward to being involved in them because they would think, gosh, here's another option for me.
That's right, it's an option, so you know, to look at the information, look at the pros and cons of taking part and make a decision.
Obviously, if it works, huge benefit.
That's right.
But what are the risks?
Well, you're always told about the risks. There are always risks with any drug, even ones on the market. But you need to talk to the doctors involved. There's lots of protections for people. Trials to go through an ethics committee, it has to go through the Ministry of Health, and then you've got all the information to make your own decision. Now, of course, we've got to talk about the case in the UK in 2006, where 6 people were horribly injured in a trial. However, you've got to bear in mind, that was the first time in humans, and of course, every drug has got to go into a person for the first time at some stage.
That was the first time it had been tested on humans.
That's right. But, you know, 9 million people a year are on clinical trials. I've been doing this for 10 years. That's the first problem I've ever come across. So, not to downplay it, it was horrendous.
No, but I guess that is something to keep in mind, that if you are in the first phase of testing on humans, that it is riskier than when further down the track.
Definitely.
So what do people get out of them being one of the patients to be trialled and be in a trial like this for the first time?
Well, probably some people want to receive money for this, and there is some large sums of money involved, set by the ethics committee, but it's because you might be in hospital for 2 weeks.
And what kind of money are we talking about?
Well, it could be, say, $5,000.
$5,000.
But, you know, you're in hospital for 2 weeks, you're having a new drug tested on you, and lots of blood tests and inconvenience. So that's the sort of money involved.
Overseas, you hear sometimes about people doing it as a way of kind of making money. Is the money more significant overseas?
No, that's the overseas rate.
Oh, OK.
Yeah. But I'm trying to bring more phase 3 trials to New Zealand. They've been tested for around 10 years already in several thousand patients, so I want to get that work going over here. What have
you've got a couple, I mean, what did you say before, 50 trials?
I've done previously.
50. I mean, that is a big deal for people who suffer from certain illnesses, from certain diseases, I suspect, to be the first people to be trialling a new drug.
That's right, and you know, there's lots of benefits from being on a trial. We've talked about the risks, and rightly so, but you know, you can get a drug that's not available other than on the trial. I mean, I watch breakfast every morning, of course, and you know, 2 weeks ago the headline one day was a new drug for prostate cancer. Last week the headline was a drug for Alzheimer's. You know, new drugs are important, they're exciting, we all want to be healthy. You've
got a test at the moment, or just about to start, for autism?
Yeah, so we've been chosen as the first non-USA centre to take part in trials of what will be the first drug for autism, starting early next year. It's very exciting.
Is New Zealand a good place to do these clinical trials?
It is. We've got some good researchers, a keen population. We're just a bit far away, but I think with a bit of enthusiasm we can bring the trials here.
Our size is not a problem, we're big enough?
We've got 4 million people, there's plenty of people here.
And the distance, as you said, is that the only thing that goes against us?
Well, no, there's another barrier, and that would be Pharmac, and companies like to do trials where there's a market afterwards to sell the product, and we have the toughest market in the Western world, no doubt about it. And so some companies are openly saying they won't do trials here because of Pharmac. However, globally there's a real shortage of people to do trials, and I still think we can attract them here.
And Shaun, just before you go, if people want to be involved somehow, how can they get involved?
Well, just talk to your doctor. We can go to our website, clinicans.com, and there's lots of information out there on clinical trials.
Great. Shaun, thanks very much for joining us. Dr. Shaun, our medical researcher.